Hi, I'm Dr. Maria Darcy. I'm a licensed psychologist and certified sex therapist with a practice here in Newport Beach and Irvine. I appreciate you taking the time today to visit my website and also to listen to this presentation, which I hope is helpful to you as you make your decision about pursuing therapy and certainly in terms of whether or not I'm a good fit for you. What I'd like to do here is to tell you a little bit about the work that I do in the sexuality, sexual health, sexual functioning um, area. I became certified as a sex therapist about 8 years ago. Prior to that, I certainly was working with issues in this area, but my certification happened 8 years ago, and I probably have worked even more extensively with these concerns since then. I work across the age span from people in their um, 18, 19 years old, all the way through to people in their 70s. I also work with people of varying sexual orientations, gender identifications, sexual identity statuses. Um, Probably in terms of one of the areas that I work in a lot are working with people who are just trying to explore and figure out sexuality questions. And so that's a good portion of the work that I do, and people who are trying to explore sexual identity questions, and that may be around understanding themselves as sexual beings, understanding some of the needs and desires they have sexually, and trying to figure out, what that means for them and how to navigate that in the world of relationships. So I work with sexuality and sexual identity concerns quite a bit. I also work with sexual functioning concerns, but also kind of just sexual concerns in the context of the relationships that in which those occur. So, for example, I may have people come in to me who are, trying to explore their level of sexual desire. That may be individually, or that may be in a couple's context. Some people may be coming in because they experience low desire. Some people may be coming in because they experience what they consider as high libido or strong libido and want to kind of figure that out. Couples can come in because they experience differences in levels of desire, and they want to kind of figure out how to understand that, how to navigate that, maybe how to shift some of that. And I certainly can work with people in all of those ways. Sometimes people come in with differences in things that they want to happen in their relationship. So not just in terms of desire, but also in terms of kind of the kinds of experiences that they'd like to have. That can happen individually, in terms of just the kinds of sexual experiences people, would like to pursue. But it can also happen in relationships in terms of the kind of sexual experiences that people would like to have occur. And sometimes people have differences around those areas in a couple's context or in a relational context. And it can be helpful to come into a therapist to, I think, talk openly about kind of where people are coming from, talk openly about what that may mean, and talk openly about kind of going forward in terms of, what that might mean. Another area that people come in with may be related to concerns around sexual functioning. So people can come in with concerns around having pain during sexual intimacy. People can come in with concerns around being able to participate in whatever sexual experience they would enjoy fully. And that can be for a whole range of reasons. It can be because of health changes. It can be because of maybe just because of the aging process. It can be because of life stressors and anxiety or just stress that has resulted in a person just not being able to bring the kind of energy to the sexual experience and the sexual relationship as they would normally or as they would like to. So I think there's lots of reasons why there can be an impact on sexual functioning for both men and women. And I think in the context of sex therapy, you can really explore those different areas and come to a greater understanding of what's really going on, and have that, especially within a relational context, done in an environment that is really constructive and also that is really protective of the individuals and their levels of vulnerability, but also ultimately hopefully helpful in terms of going forward with just more satisfaction in that realm in their relationship, and more of a capacity to participate to the level and extent and of the quality that they would like. Other reasons why people might come in terms of sex therapy, people can come in because possibly they have had a history of trauma or some traumatic experiences in that realm that they feel are playing out in their current relationships or in their just current sense of self. And certainly I can work with people around those concerns. Sometimes people come in because they are trying to figure out questions around how to connect their sexual relational experience with their emotional and more intimate relational experience, and kind of trying to marry those two. Certainly people experience, I think, intimacy in very different ways, and sometimes, what makes one person feel connected and secure and loved is different than what results in that for another person. So I think sometimes couples come in wanting to talk more about what that is and talk more about ways in which that can be realized in their relationship. And also sometimes couples want to come in and talk about ways in which they can connect physically and sexually that is just, about connection without it needing to be more about deepening an intimate bond. So I think people can be sexual and physically intimate for all sorts of reasons, and sometimes people just need to talk about that. I certainly really enjoy working in this area, and I think it's very important that if an individual or a couple are wanting to work around these concerns in a therapeutic context, that they do work with somebody who has more specialized training. Just because I think it is very much a specialized area of work that's very much connected to certainly more psychological and emotional and health and well-being concerns. But I do think there's a specialized aspect to it that's important to acknowledge and respect. Certainly, if you would like further information from me in terms of the kind of concerns I work with and whether or not I can be helpful to you in terms of whatever it is you're dealing with, please call me on the number that's provided on my website or send me a message on the form on my website, and I'll be sure to get back to you. I hope this has been helpful to you, and certainly if going forward you're going to be in contact with me, I look forward to that, and in the meantime, take very good care. Thank you.